Welcome back at 8:17. New steps being taken to address maternal health disparities amongst communities of color. A maternal mortality review board has been tracking the numbers in New York State, and it finds black women are more than twice as likely to suffer from severe pregnancy-related complications.
They're also 5 times more likely to die from pregnancy-related causes than white women. The review board has determined that 76% of these deaths, they were preventable, and that discrimination was likely in nearly half of those cases. As an African-American woman and a mother, these statistics hit close to home for me, truly. And this morning, we are joined by 2 women dedicated to reversing those numbers just stated. We have Lisa Price. She is a founder of Carol's Daughter, and Latham Thomas, a doula and founder of Mama Glow. Good morning to the both of you.
Good morning.
Good morning. Thank you for being here to highlight this important work.
Thank you for having us.
Of course. You ladies have come together for this initiative, Delivering Love. What is it, and why did you think it was so necessary?
Well, Love Delivered is an initiative that looks at the Black maternal health crisis in this country and advances maternal health outcomes through a couple key factors. One is ensuring that parents who would like a doula present at their birth can actually have one. We have a lot of people who are underinsured or uninsured in this country, or maybe Medicaid eligible but may not be able to get access to resources. So through the work that we do, we're able to have people apply for services. They get matched with a doula in 6 major U.S. cities, and then that support allows them to have the education that they need, but also the hand-holding and the birth or postpartum support they need to get through that critical and most beautiful time of their life.
A lot of people may not be familiar with what exactly a doula does. In Greek, it means helper. I was really blessed to be able to have a doula in my pregnancies and deliveries, and talk about how they're also sort of an extra layer, sort of an extra slip clutch of advocacy in that space as well.
Yeah, absolutely. I mean, doulas are non-clinical care providers. They offer emotional support, physical support, education, advocacy tools, which is a big part of the work that we're doing at Love Delivered.
To help the parents have a voice as they're in that space.
Absolutely.
Yeah.
Yes. And then if you have, you know, we think about it like having a producer for your birth, right? So think about like if you have a wedding that you're planning or something like that, you have someone who's thinking about all of the details involved in your birth process.
And can help prompt the father to ask questions, or prompt your extra person that's there for you in that space and time.
And they have a different understanding of the process, the administrations that are at play, the politics of the hospital. They can navigate those things a lot easier than you can. And you're supposed to be focused on your birth. The partner who's with you during your birthing process, that's what your focus is supposed to be. So they allow you to focus on that, and then they can advocate on your behalf.
Right. We were talking during the commercial break about these rates and the progress that's kind of stagnated. You guys have been around for 5 years now. How do you want to expand what you already provide?
I first would like to say that we're really proud of the way we've been advocating. I think we set a model in place that's been a blueprint really for how other organizations, people who are in the space also advocate. We've reached over 10 billion people through digital advocacy, over 500,000 people through our live events and education efforts through Love Delivered. So I feel like that has been a big piece of the trend in getting people just basic information, you know, like because if we were talking 5 years ago, people would say, yeah, I know what a doula is, or yeah, I think I understand a little bit about the maternal health crisis. But through the work that we've been doing consistently through webinars, presentations, through live events,
and even legislatively, we now see Governor Hochul here in New York has them covered by Medicaid,
yes, doulas
which you had touched on that. There's a first ever state directory so that you can find a doula, because otherwise it's like, what do? You just like Google it and somebody with an ad pops up. So talk about how those steps are important in getting women to where they need to be in this safer delivery space, so it doesn't have to mean their life ends to bring life to this world.
I mean, that education and awareness is so key.
Yeah, information is power. When we first started 5 years ago, just having the conversations to do what we were doing, someone on our team ended up advocating for herself, getting a doula because she was pregnant. It was something that she didn't even think about until she's doing the work with us to build this.
Right.
So that ripple effect, you know, if we affect one person, we
Keep
affect
talking
so
about
many
it.
other people.
This is what we all need to keep doing, right?
Absolutely.
And talked about that advocacy. You mentioned the webinar. Give us the details about that.
So there is a webinar that we're hosting tomorrow. It's called Bumping While Black. And it is sponsored by Carol's Daughter, and you can attend. You'll be able to hear from physicians, from mental health providers, as well as nutritionists.
Where do people find it?
You can go to mamaglow.com.
mamaglow.com. Okay.
Yeah.
Lisa Price, Latham Thomas, thank you so much for stopping by. And we're also going to put a link to register for that webinar on pix11.com. You'll have a replay available for people too? Good. So you don't have to be there live in person.
Exactly, because we know how busy people are.
Absolutely. Powerful team. We thank both of you for being with us.
Thank you.
Thank you.